This is Dr. Caudill Miller with Dr. Miller's Guide to Neurology, and we're talking about everything that I treat in a private practice in clinical neurology. And we've been talking about headaches, but I'm going to talk about Topamax today, which we use for headaches, but it's also a drug we use for epilepsy. You know, when I first started treating epilepsy, we had Dilantin, phenobarb, and Tegretol. That's all we had. We treated thousands of epileptic patients just for those three drugs. And Topamax was one of the first of the newer drugs that came out for epilepsy. We were so excited we started using it. And we all noticed that people with epilepsy that had headaches, their headaches got better, and then studies came out and described how well it worked. So we just started pounding people with Topamax for headaches. And it's just been a remarkable headache medication. So we talked about these three mechanisms that occur with headache: constriction of blood vessel, dilatation, a release of chemicals. Number two, a tsunami of electricity across the brain. And that's why Topamax helps with epilepsy. It helps with this tsunami of electricity across the brain, which you see with migraine. So it's a great headache medication. So who do you avoid Topamax with? Well, the first group is kids in school. I mean, it'll drop their grades. When I first started using it, I saw kids, their grades would drop from an A to a B, and then would come back the second 6 weeks. So if you're going to have to use it, start it in June. Give them several months to get used to it, and they're generally fine. You warn adults, you have a little bit of the dumb blonde syndrome when you first start taking it. It'll go away. It seems to be worse at the low doses, and it gets better as the doses go up. Don't use it with kidney stones. It can cause a kidney stone. So we don't use Topamax with kidney stones. I've had a couple of patients that had kidney stones and wanted to try it, and they're taking it. I'm just holding my breath that they won't get a kidney stone, but it just works great for them too. But just be cautious with kidney stones and try not to use it. Any form of glaucoma, it's really more relevant to narrow angle glaucoma, but as neurologists and lay people, any form of glaucoma, I would not take Topamax. And if you've not had an eye exam, make sure you get a good eye exam. We've seen young people that had not had eye exams that develop acute narrow angle glaucoma, and it can cause blindness with Topamax. So you've got to be cautious. Anorexia nervosa, you can't use it because Topamax will cause weight loss, and we'll talk about it in a minute. So the main side effects we mentioned, the first one is just cognitive dysfunction. Just always warn people, don't use it in school. Tingling in the fingers, this is a big one, and we stop it 2 or 3 times a month for people just driving them crazy. Their fingers tingle. We try cutting the dose back and to work way back up, but it is annoying. Drowsiness, all the anticonvulsants cause drowsiness. Sometimes alteration of taste, we don't see that much. Weight loss is the big one, and man, we love Topamax for that reason. If you have someone with headaches, they're a little bit overweight, and they're trying to lose weight, Topamax will be their friend. We've all been surprised Topamax has not been released as a diet drug, so I wouldn't be surprised if it's released as a diet drug. So that's Topamax. Like my channel, subscribe, make any comments. We're going to keep talking about clinical neurology.